Welcome to Trends in Rehabilitation Medicine podcast. So, why this podcast? So, I've had a passion for inpatient rehabilitation medicine for a long time. That is my area of practice. I will tell you, when I decided to choose inpatient medical rehabilitation as my specialty, I was talked out of that by several people for different reasons. Inpatient rehabilitation does not usually seem like the sexy aspect of physical medicine rehabilitation. And so I had some wonderful people tell me to consider sports medicine or spine or something like that. But I really love inpatient rehabilitation medicine. I love the interaction with the patient. I love watching them improve and that continuity of care. The other thing that I noticed though was that there's limited knowledge. Having been someone who've worked with other physicians as well as residents who are physicians in training, I realized that some of the rules and requirements that are involved in the inpatient rehabilitation settings are not always taught to people. And sometimes people know them, but they don't keep up with them and they change so quickly. There are also audits out there that occur, and there are ways to prevent these audits, ways to document in a way to protect yourself. And sometimes if you don't know these things, then you end up not being able to document in the most in the best way. There are also resources out there. You're used to your inpatient rehabilitation setting, but other rehab facilities and units, they may use different resources, different ways of treating patients, different equipment, different techniques and strategies. And this is just a great place for you to learn those things. We know that there are facilities out there that have failed, some of them because of poor management, some of them because of audits. And then we have success stories. There are facilities that have thrived and survived and have been expanding. And so there are lessons to be learned from both. How do you learn that lesson? Well, you come right back to this podcast where I will review some of these facilities as well as interview people that work in these facilities, that lead these facilities, so we can learn from them. There are things like site neutral payments. I was surprised to see that there are actually professionals in the inpatient rehabilitation setting that did not understand site neutral payments and what it means for them and what it means for their patients. Well, this is a place where you learn those things. There have been many new proposals to change how we document, how we practice in the inpatient rehabilitation setting. Well, this is the place where you're going to learn those things. And the other thing that I found, there are other podcasts out there that focuses on physical medicine and rehabilitation, but you won't find any right now that focus 100% on the inpatient setting. Well, this is the podcast that will do that. What to expect in this podcast? How we're going to set this up? Well, in order to give you the best education and information and resources, we will generally have two things. We'll have monologues where maybe I just need to come on and share with you the latest changes coming out of CMS, or review a new equipment that came out that probably you can use in your rehab, or talk about a new practice or new strategies. The other thing is interviews, right? We will want to learn from others. So we'll get interviews from some of the giants in the inpatient rehabilitation space that will help to teach you and educate you. The episodes will generally be about 15 to 30 minutes. I don't want to waste your time. I want to get to the point and share what you need. I know you guys are busy in the inpatient rehabilitation setting. I know that because I am there with you. You'll have a new episode out on Wednesdays at 7 a.m. Eastern Standard Time. And it will be released on all podcast sites, but the main podcast site that the inpatient rehab podcast will be housed is on Spreaker. You will also have a YouTube page where we will be airing this podcast as well. A little bit about me, your host. My name is Dr. Diane Thompson. I am board certified in physical medicine and rehabilitation, brain injury medicine, and lifestyle medicine. And I have actually figured out a way to use lifestyle medicine for many of my patients in the inpatient rehabilitation setting, such as my stroke patients and cancer patients. And it's a wonderful practice I will talk with you more about. I've also been the medical director of an inpatient rehabilitation unit, and I'm currently the chief of a rehabilitation department. Some interesting facts about me. Prior to medicine, I was a nurse, a registered nurse, then a nurse practitioner, and an adjunct nursing professor. I'm also a two-time Amazon best-selling author, an award-winning speaker. I am passionate about journals. I believe they can change your life. And so I've created and will continue to create journals. I also was a radio host of a syndicated radio show called Health Talk with Dr. Diane Thompson. So now you know what to expect from Trends in Inpatient Rehabilitation Medicine podcast. What do I expect from you? Well, this is a space for you. It was created for you, the professional that's in the inpatient rehabilitation setting. And so I want you to come back each week. Come on back each week, subscribe, share, and rate this podcast. As you well know, we have about 1 million podcasts out there. In order for this podcast to get noticed and to be able to get the information to those we want to get it to, we need active interaction with the podcast, and that comes in the form of subscribing, sharing, and rating. The other thing is this podcast is for you. We want to share the information that you want to learn. And so if you have a question, a concern, a comment, if there's someone you want to bring on the podcast, you want to hear an interview from them, if you want to learn about something, email me at inpatientrehabtrends@gmail.com. That's inpatientrehabtrends@gmail.com. And also you can find me on my website at drdianethompson.com. That's DRDIANETHOMPSON.com. I look forward to seeing you, the inpatient rehabilitation medicine professional, right here every single week.